So then we're going to start talking about tumors specifically. So in particular, the classification and staging of tumors. So a little bit of nomenclature. Benign tumors have the tissue name plus the suffix oma, like adenoma or lipoma. There's a little, there are a couple tables in the book that talk about a nomenclature. Malignant tumors, also known as cancers, have the tissue name plus the suffix carcinoma. So if it were a benign tumor, it would be an adenoma. If it's a malignant tumor, it's an adenocarcinoma in the same tissue. Tumors of connective tissue are usually termed sarcomas and are often malignant. So there's several malignant tumors that have unique names like Hodgkin's disease, Wilms tumor, leukemia. So we'll talk about all sorts of different ones while we are going through this, and in other chapters as well. So benign tumors usually have differentiated cells, meaning the cells are similar to the cells in the area, but the cells, they reproduce at a higher rate than normal, normal for the cells in the area. Benign tumors tend to be encapsulated. Any tissue damage from benign tumors tends to result from compression of adjacent structures. So it's just kind of edging things out. In the brain, this can be life-threatening. In other areas, it might not be. Malignant tumors, they are undifferentiated, non-functional cells. So they're producing at a high rate and they're not taking the time to differentiate. There's rapid reproduction and abnormal mitotic figures, so they look wrong under the microscope. Malignant tumors have the ability to infiltrate or spread into surrounding tissue. They're not encapsulated like benign tumors, and they can spread to distant sites, which is called metastasis. So here's our two pictures of the benign and the malignant tumors. The benign tumor, it's an encapsulated, slowly expanding mass. The malignant tumor is irregular, abnormal cells with irregular size and shape, and they're invading the tissues around them. So locally, the effect of tumors can be pain, but if you just have a small tumor, it might not be pressing on anything. You might not have any pain. When the tumor is well advanced, it's big enough to compress local structures, that's when it can result in pain. And the severity depends on the type of tumor. A lot of times, someone might have a tumor somewhere, and they don't know about it until it gets detected in some other way. Like they were in a car accident and ended up getting a chest x-ray and a tumor shows up somewhere. Something like that. Or they have some other diagnostic test that ends up showing a tumor, particularly with ones that are deeper in the body. If you don't have any pain and you don't have any symptoms in the early stages, it doesn't often get affected or doesn't often get detected until the later stages. So obstruction occurs when a tumor compresses on a duct or a passageway. So blood supply or lymphatic flow might be restricted, the digestive tract might be restricted, or airflow in the bronchi, in the lungs, might be restricted. So you can also have tissue necrosis and ulceration locally from a tumor, and it might lead to bleeding or infection around the tumor. So that might be your source of unusual bleeding or discharge somewhere, having that tissue necrosis. So that's why it's one of the signs of cancer. So this is just some examples from the book of possible obstruction by tumors. The first one is showing tumor blocking the airflow, and the other one is showing obstructions in the colon from tumors. So it can be internal or external obstructing. So malignant tumors or cancer, they lack control of mitosis and they don't undergo apoptosis. So the mitosis is just out of control. It's dividing. Whether it's good or not, it's still doing it. And the cells don't die even though there's something wrong with them. So that's why they have that uncontrolled growth. There's no normal organization or differentiation of the cells. there's no contact inhibition. In other words, it infiltrates other cells. It doesn't say, oh, I'm not supposed to go there. It just has no control of that. Abnormal cell membranes, altered surface antigens, and a lot of times the cells don't adhere to each other and they break loose from the mass. They might invade other tissues and spread to distant sites. So we're going to talk about, in modalities class next quarter, we're going to talk about contraindications for and precautions for doing modalities. So if someone has cancer, that's often a contraindication for something because we don't want to do anything that's going to cause those cells to break loose from the mass and spread to distant sites. So malignant tumors, sometimes the mass can compress blood vessels, leading to necrosis of other tissues and inflammation around the tumor. The tumor cells might secrete enzymes or hormones that cause the breakdown of proteins in cells, and they might cause systemic effects such as altered calcium levels. If you had a tumor on the parathyroid gland, you might be excreting more hormones and alter your calcium level. You also get inflammation and loss of normal cells, so the normal cells aren't doing their job, and this can lead to progressive reduction in organ integrity and function. So sometimes the symptoms come from that, from the fact that the normal cells aren't able to function. Angiogenesis is where the tumor cell secretes growth factors which stimulate the development of new capillaries in the tumor. So now it's taking the body's resources. It's saying, okay, I need new capillaries, I need a blood flow. It's sending out these chemical messengers and extra hormones. Sometimes that's how things really start to go wrong and you really start to see a lot of big symptoms. So when the malignant tumors are producing a hugely abundant number of enzymes or hormones, it's called paraneoplastic syndrome. So we'll talk more about that later. So malignant tumors, they spread by invasion and metastasis. So invasion is a local spread where the tumor cells grow into adjacent tissues. And the example given in the book is where a uterine carcinoma invades the vagina. It's invasion in adjacent tissues. Metastasis is where the tumor spreads to distant sites, usually via the blood or lymph or other body fluids. The example is a carcinoma of the colon that spreads to the liver. So it's not just the adjacent tissues, it's distant sites. So there are two ways that cancers are classified. The primary site where the cancer first developed, so when in the previous slide the carcinoma of the colon was the original site, and then histologically by the type of tissue where the cancer originated. So when they're classifying by histological type, there are literally hundreds of different cancers, but they're usually placed into one of 6 categories. So the International Classification for Diseases for Oncology, 3rd edition, defines 6 major histological categories: carcinoma, sarcoma, myeloma, leukemia, lymphoma, and mixed type. We'll talk about each one briefly. So carcinoma arises from epithelial tissues such as the skin and lining of internal organs and accounts for 80 to 90% of all cancers. So hugely predominant type. There are 2 major subtypes of carcinoma: adenocarcinoma, which develops in an organ or gland such as the lung, prostate, breast, ducts and lobes, and the colon, or a squamous cell carcinoma, which develops in the squamous epithelium. The skin is most common, but also digestive and respiratory tracts in certain organs for the squamous cell carcinoma. Sarcoma arises from connective or other non-epithelial tissues such as muscle, fat, nerves, and bone. Sarcomas are estimated to account for only 1% of all adult solid cancers, but over 20% of all pediatric solid cancers. Interesting, I think. There are more than 50 types of sarcoma, typically grouped into 2 main kinds: bone sarcoma, osteosarcoma, and soft tissue sarcoma. And soft tissue sarcoma is the most common type. So myeloma they are plasma cell neoplasms arising from plasma cells of the bone marrow, and it's estimated that 1.8% of all new cancers are myelomas. There's multiple myeloma, which is the most common, and it's found in multiple places in the body, or a plasmacytoma, which is a single mass. So it's really, you can think of myeloma as being bone marrow cancer. 1.8% of all new cancers. Leukemia starts in the early blood-forming cells found in the bone marrow, most frequently of the white blood cells. So leuko means white, and so you can almost think of leukemia as white blood cell cancer. It's the most common cancer in children and teens, and it's an estimated 3.7% of all new cancer cases. So leukemia can start suddenly, and it's considered acute, or progress slowly, and it's considered chronic. The type of leukemia is based on the cells involved. Myelogenous is the white blood cells, or lymphocytic is the T cells, B cells, or natural killer cells. So we're going to talk more about leukemia next quarter in the blood and lymph disorders chapter, and we'll talk more about lymphoma then as well. And that's the next category. So lymphoma arises from lymphocytes in the glands or nodes of the lymphatic system. The lymph vessels, nodes, spleen, tonsils, or thymus. There are tons of different subtypes of lymphoma, but there are two main categories, Hodgkin's and non-Hodgkin's lymphoma. And when I'm saying the incidence of new cancers, I am just, you don't have to memorize that, obviously. I'm just trying to give you an idea of what the incidence is. And we will talk more about lymphoma in the blood and lymph section next quarter. So the last classification is mixed type. So there's more than one histological type, and so they're considered to be mixed. So like an adenosquamous carcinoma, or a carcinosarcoma, or a gastric mixed type sarcoma. So it's like the miscellaneous category. So cancers are staged to concisely explain the extent of the disease. So the staging process usually begins at diagnosis. It doesn't change over time regardless if the tumor shrinks or the disease progresses. They go with what they first staged. So the cancers are usually grouped as either solid tumors or liquid tumors. So liquid tumors are blood cancers and hematologic malignancies, and solid tumors are everything else. So usually with a liquid tumor, it's not like a growth that you can pinpoint. They're throughout the blood or throughout the lymph system. So solid tumors use the TNM classification. That's the most widely used system. The system was developed by the American Joint Committee on Cancer and the Union for International Cancer Control. T is the primary tumor, N is the regional lymph nodes, and M is distant metastasis. So the combination of ratings for the TMN then provides the stage grouping. There's a different staging system for brain and spinal cord tumors, but for all the other ones, they kind of use the same one. So the groupings are stage 0, they use the TNM ratings. Stage 0 is a carcinoma in situ. So there are abnormal cells, no cancer, but the cells could become cancerous. So that's that precancerous stage. Stage 1 is an early stage. No cancer cells are identified in the regional lymph nodes and no metastatic disease. So there's just the tumor, but no lymph node infiltration and no metastatic disease. Stages 2 and 3, the cancer cells are localized, but they are invading nearby tissues and structures. And there are divisions of 2 and 3, like 2A and 2B. And we're not going to go into detail on that. Stage 4 means there's metastatic disease. The cancer has spread to distant areas of the body. So liquid tumors, there's not really a standard method of staging liquid tumors, but they consider the histological classification leukemia, lymphoma, or myeloma. Leukemia is blood cancer, basically. Lymphoma is lymph cancer, and myeloma is plasma cell cancer. So leukemia is divided into acute leukemia and 2 different types of chronic leukemia. And again, we'll talk more about all 3 of those next quarter.